How's it going today, Mallory?
I'm okay. How are you doing?
I'm doing great. So, looks here, I haven't seen you in a couple of weeks, and you just entered your third trimester, I see.
did, yes.
How is that going?
It's going okay. It feels a little different than my last pregnancy.
Yeah, what sense?
Well, I just feel like I'm just so much more tired than my last one, and I just get so out of breath just doing my normal things. I'm usually very active, and I was able to exercise through my whole last pregnancy, and I can't hardly get up the stairs anymore. And I was concerned about that, so they went to the doctor, and they did all these tests. They did an EKG, and it turns out that I have cardiomyopathy.
Oh, okay.
So,
what is bringing you in today?
well, I came in today because I've been having this really bad back pain, and I know everyone gets that when they're pregnant, but it's just really stopping me from being able to just do my daily chores around the house and play with my other little kid. So I'm really hoping it goes away before I have my next one in a couple months.
Okay. And then, was there anything that you do that seems to trigger the back pain more, or is there a position you can be in that helps decrease the pain?
It's kind of a dull and consistent throughout the day, but picking things up and twisting makes it a little worse.
Okay. How is it at night? Is it waking you up during the night, or are you still able to sleep through the night?
I've had some trouble sleeping through the night.
Okay.
Kind of been using an extra pillow and propping myself off. That seems to help.
Okay. And then you said that these symptoms are different from your last pregnancy. So, did you notice any, activity level-wise in your last pregnancy compared to now? You said you're more fatigued.
Yeah, last time I was able to do pretty much consistent exercise first, second, third trimester.
Okay, so
and
now not much of a difference, really.
Yeah.
Okay. Okay. So I would like to do some tests. We'll do just some manual muscle testing. That's okay with you.
Mm-hmm.
Just check your hips. And then last quick question: on a pain level of 1 to 10, where do you think you are? Your back.
Right now, I'm at probably a 5.
A 5.
Mm-hmm.
Okay. And then any other symptoms aside from the back pain that you've noticed?
Just really extra tired and fatigued, and I get out of breath really easy.
Okay. Sounds good. So, first, we're going to check your hip flexors. So I just want you to bring your legs up, pretend that you're marching on the table, and you can actually stabilize yourself on the table as well.
Okay.
Yep. So how does that feel?
It's a little difficult.
A little difficult.
At least can't be
Yeah,
way
I
too.
was just thinking that. Yeah. Okay, so I'm going to have you bring your leg up, and then I'm going to add a little bit of resistance, so don't let me push you down, okay? Okay. We're going to check this other side.
Okay.
You can bring your leg up again. Okay. So I noticed that you have some swelling too. Is that?
Yeah.
Did you have that in your last pregnancy as well?
A little bit, but it's way worse this time. I mean, I think this one's just growing so fast. I gained like 5 pounds last night.
Just between last night and today?
Yeah.
5 pounds?
Yeah.
We're going to drop a red flag on that.
I'm going to try and push your legs out, and I just want you to resist against me.
Okay.
Yep. Okay, good job. Now I'm going to try and push your legs in, so now just resist against me again, okay? Okay, so I'm seeing some weakness there, so that's going to be the first thing we check.
Okay, so what I want you to do is just kick this leg out, touch my hand up here, and you can use this bottom leg to balance yourself.
Okay.
Yep. So just bring it up to about here. Does that feel okay?
That feels okay.
And now I'm going to add a little bit of resistance, and I don't want you to let me push you down, okay?
Okay.
Okay, so we're going to do that one more time. I'm going to add a little bit of resistance here. Don't let me push you down. Okay. And then can I have you roll over? I'm going to check the other side real quick. Okay, Okay, so it will be the same thing.
Okay.
Okay?
Oh.
Don't let me push you down. Okay. One more time. Okay. Alrighty. Yeah, so I'll just have you sitting on the side of the table again. I'm going to make a quick note in the computer. I'm just taking notes as we go so that I don't forget or I'm able to write down exactly what's happening.
Sounds good.
If that's okay with you.
Yep.
Okay. Okay. So now next thing, I want you to pretend that you're kicking a hacky sack.
Okay.
Okay? So I'm just checking, I'm just checking your range of motion right now. And so now I'll check your strength. Can you kick your leg in again? Thank you. Hold. Good job. You can kick your leg out. Hold. Thank you. Lift your leg real quick. Thank you. And I'm going to pop it under this leg. Okay. Okay. So again, kick your leg in. Thank you. Kick your leg out. Perfect. Okay. Kick your leg in again. Hold. Good job. You can kick your leg out. Hold. Thank you. Perfect. Okay. So we'll take this. And then because we're going to check your extension as well, but I'm not going to have you lay on your stomach because it's not going to be the most comfortable thing. So, yeah. So what I'm going to have you do is bring your leg up. And I'm going to add resistance here, and I just want you to push into my hand with your thigh, okay?
Okay.
Okay. Whenever you're ready. Good. Okay, so then we can do this one. Okay. Good. Okay. Sounds good. We'll just make a couple of notes real quick. Okay. So, how long do you think you typically can walk around before you really start to feel the fatigue set in? Like, is it mainly if you're just going up and down the stairs, if you're just walking down a hallway?
Stairs are worse. I'd say the hallways in our house are about the length from here to that wall, and if I were to do that twice, I'd be pretty tired.
Okay, sounds good. So we're just going to do a couple of exercises right now, but before we start, I'm going to check a couple of your vitals.
So then, did they prescribe you any medications
Oh,
for your cardiomyopathy?
Yeah, the doctor, he gave me a prescription for propanolol.
Okay, sounds good. So a beta blocker. And then did they tell you just some side effects of that?
I don't remember.
Okay, so the main one is that it's just going to naturally lower your heart rate. So just keeping that in mind when we're doing some exercises, or if you're doing exercises at home, that you will have a naturally lower heart rate, so it might take longer for heart to pick up when you're doing more high intensity exercises.
Okay, that makes sense.
Okay, so before we get started, I am going to just take a couple of vitals. So I'm going to check your blood pressure and I'll check your heart rate. Do you know what your blood pressure normally is at, typically?
I don't remember exactly, but they've never told me it's super bad.
Okay, well that is good to know. Do you have a preference in your arm?
Nope.
Okay, so we'll just do this one then. And then do you know what your heart rate is normally at?
My Fitbit might tell me. 74 right now.
74. Okay. We'll use this arm. I'm just going to wrap this around. And if you ever had your blood pressure taken before?
Oh, yeah.
Okay, perfect. So you know what to expect.
Yep, doing all sorts of tests.
Sounds good. Put that in here. Then I'm just going to have your arm resting on my arm. Okay, just like that. Sorry. Okay, so it looks like you're at 110/65 right now. And just take your heart rate real fast, and then we can move on to some exercises. Actually, let's go with this one, just because of your watch. Okay, take that. Thanks. Thank you. Okay. So it seems like your heart rate is very accurate. I'm getting about 62, or not 62, 72. Okay.
For safety precautions, I'm just going to apply this gait belt.
Okay.
And then just let me know if it's uncomfortable, because we can definitely reposition it or make it looser. Okay, so how does that feel?
That feels fine.
Okay, so before we start, I'm just going to be taking your vitals as we go. So, our first thing that we're going to do is I'm going to set up this chair over here, and I just want to see how you do walking to this chair, okay?
Sure.
Okay. I'll lower that for you. You're welcome. Okay.
See, I'm tired already.
Yeah?
Yeah.
Okay.
Should I go here or?
No, yeah, let's take a break if you're tired already. Okay, I'm going to check your vitals again. So how are you feeling?
Really tired. I feel like that shouldn't make me tired. I used to be able to run a couple miles before this.
Yeah?
Yeah.
So on a scale of 1 to 10, how are you feeling, like, exercise exertion-wise? Was that pretty hard? Or you feel like your heart's beating pretty hard?
Yeah, I feel like I was working pretty hard, even though it doesn't seem like much.
Okay.
I mean, I would say I couldn't go that much further. Maybe I'm at like a 7, 8.
A 7. Okay. Okay. So yeah, this time around, you're now 125 over 90.
Well,
which
that
is
went
a-
up.
Yeah, it's a pretty big increase in yours. So we're gonna drop a red flag for that. I don't want to. I know that seemed very minimal, but I don't want to push you anymore.
Okay.
Just because it's the cardiomyopathy, I don't want to overwork you. Did anyone come with you today, Mallory?
Yeah, my husband's here with me.
Okay,
He's in the
perfect.
waiting room.
Okay, sounds good. So what I would suggest, just based off of the symptoms that I'm seeing, if you guys are able to go to a local hospital and just get some more tests done on your heart, tests that we just can't offer here, just to make sure that everything's going okay, just because I know that you have cardiomyopathy.
Okay,
So-
yeah, we can do that.
Okay, perfect. And I'll see you soon.
Okay, sounds good.
Okay.